So, how much protein should cats eat? The minimum requirements is 2.5 grams. By body weight, 2.75. It's formula. You can count it. The least is 1.6, but I don't recommend it because the cat will be skin and bone after that. And the maintenance, the best is 5 grams. So if you have, we have really popular advertisements in my country with the food, like you see it everywhere, really happy animal running for the bone, really shiny fur in a cat. But if the cat will be really eating that diet, it will be looking completely different because they really need to have proteins in the diet. If they have more carbohydrates, they will be fat. Like, do you guys know McDonald's? Do you have McDonald's here? So it's like you will be eating hamburgers only the whole life. You will be fat and you will be sick. That's the same with cats eating bad diets. If the cat is long-term on low-protein diet, it will be skin and bone. It will lose muscles because feline liver, they are not interested in low income of proteins. They just go the same the whole life. So if the cat is starving several days, it will literally proceed her own muscles. So that's why it's so important to, for the vets, especially guys, to know how to make the cat start eating or to do the tube feeding. Via nose, if the cat cannot be anesthetized, or via esophagostomy tube, or there are other types, you really need to start soon enough, because if the cat is sick, it won't eat. If it won't eat, it will get even more sick, not better. Abnormal energy metabolism, yes, because if you don't have enough proteins, you don't have enough energy. And also poor immune function. So I warn you, please do not feed the cats the really good advertised food. We have it in television, like you have 2 to 4% of by-side products, not even meat, and they advertise it. It should be committed. It should be concluded like a crime, trying to sell people the garbage food. And many people are coming to my practice think it's a good food for cats. I hate it. And the producers hate me because I keep telling people I cannot say the brand, but you can check on your own. The problem is if there is low protein in diet, they will be having also poor healing. And the problem is they need protein to detox the organism. They need it for the processes in the liver. So these cats can be really easily poisoned. So be careful with low protein diet. I love this book. This is my favorite one because we don't get much training at the university in dog and cat nutrition. So I use this one. It's home-prepared diets, but there is the basics about nutrition, like how much protein, how much fat, how much everything dogs and cats need, including the caloric tables. So if the cat don't want to eat diets, I can tell the owner, okay, you can cook from this because it's including recipes for dogs and cats, for kidney failure, liver failure. So I can tell them what they should feed their animal if the cat has aversion. I usually use cats, but I have unicorn today. They are also sensitive to vitamin B deficiency, especially B6, B3, and the others. I will mention it later, because they need them to process the proteins in the liver, and also to produce the heme, the color in the red blood cells. So if they are lacking B6, they can develop anemia, which is even more severe. And if the kitten doesn't have enough, it won't grow. So it can simulate a hypothyroidism in kittens, but it could be just the bad nutrition. They can have crystals in urine even. And if you have high protein diet without vitamins. It even hires the requirement of this vitamin because they need to be processed in the liver. So even the high protein diet without the vitamins can cause problems. The B3, it's needed for glucose, fatty acids, and amino acids metabolism again in the liver. And if the animal is lacking it, can cause dermatitis, mucosa, ulceration, diarrhea, and also death. Kittens can develop anorexia, fever. It can look like kalishi. You can think your kitten has kalishi, but the kitten doesn't have enough vitamins, so the differentials are, and it can die. B12, maybe you are aware of B12, that's one of the most important. It's important in heme synthesis, so if the animal doesn't have enough, can suffer from anemia. And the important thing is, if the animal has diarrhea or problems, or pancreatic problems, can have low vitamin B12 because pancreas is producing something intrinsic factor which help to transfer the B12 from the gut to the system. So if your kittens or cats are having diarrhea, they can be lacking B12. It's on the panel for gastrointestinal tract, which I use in laboratory. If the kittens are lacking B12, they initially grow normally, but later they will stop and they will start losing weight. So especially in cats which are losing weight, you can prove they have hypocobalaminema. And thiamine, it's really important one because you can cause really severe clinical signs, including neurological ones. The cat can have ventroflexion, which is this, or opisthotonus, which is this, and can have even seizures. It can look exactly the same as FIP, neurologic form. It can look exactly the same as a kitten which underwent panleukopenia in the belly of the mom. So it's really severe, and you can cause it by diet. If you feed raw fishes, they contain lots of thiaminases, which is enzymes preceding the B1 vitamin, and also the bacteria. And there is sulfuric compounds used to conserve the food, tinned food, which can kill the thiamine also. So if you are feeding food which makes the thiamine life shorter, then you can cause this. Also gastrointestinal signs. And I would like to show you the video of kitten with cerebral damage. I hope it will go. It has typical clinical signs of cerebral problem. You can see ataxia, you can see the tail upwards. The kitten is not in pain, but it's not able to move properly. You all get drunk sometime, I think. That's exactly the state. And it's trying to compensate. You cannot distinguish by looking if the kitten has underwent panleukopenia or it has thiamine deficiency. This was a rescued kitten. We didn't have enough money for testing all over the stuff. But the best thing how you can distinguish this from thiamine deficiency and panleukopenia is this kitten was not vaccinated. If this kitten has antibodies for panleukopenia, it's for sure because it underwent the infection. And that was this case. But it was our case last week, so I was really happy for having it. And we thought with my friends that we shouldn't be so excited about the clinical signs because we were like, oh, look, how nice clinical signs the kitten has. And the owner was like, they are nuts. Because it's not painful condition, but it's not really nice to look. But this kitten was super cuddly, so I hope he will find somebody to stay with. He was purring even when we touched him, but it wasn't stress purr. It was like he was really cuddling back. So cats are really sensitive to low protein content because they need more essential amino acids from the meat only than dogs. I would concentrate on taurine, arginine, methionine, cysteine. Taurine I mentioned already there, because it's essential for vision. So if they don't have enough taurine, they can get blind. Cardiac muscle function, and also the liver metabolism. Because if they don't have enough, they can die because of heart failure, and you won't find it until they are dead. Because they are the best in the hiding of clinical science. I had a case recently. It was a Sphinx, and the Sphinx was coughing 2-3 months, and the owner came to see me, and I asked how long he is coughing. They said 2-3 months maybe, but nothing severe. We did X-rays, and that was the first time I see heart like this on the X-ray. It means Valentine's heart. And I told the owner, and I told him, your cat has Valentine's heart, and also pulmonary edema and other stuff. And the owner was like, oh, it means it's nice. He has Valentine's heart, it's really nice. And I said, no, your cat will die soon. Because it means both atrium are so enlarged. So the heart was really badly functioning. And I love my mentor teacher, Susan Little. She's really good in feline medicine. She wrote several books. She said cats like to buy illnesses in sale. So they usually don't have just one. So if you find one and you are happy about it, they probably have more than one. So this poor Sphinx had cardiomyopathy. The restrictive one means the heart is not able to stretch that much, so that's why he was having really nice Valentine's heart. And he was having pneumonia too, with some really nice nasty bug, but we cannot do the proper examination on him, because if I would anesthetize him, he would die much sooner. He's already dead, but the owner was so surprised he wasn't having any heart clinical signs until the condition was so severe. So this is important. And even arginine, it's important for urea cycle, which is amino acid metabolism. And if the level of arginine is really low, the cat then can die within hours with neurological signs.